Without further ado, I'd like to in advance say thank you to our presenters today. Really looking forward to hearing from Jim, Gail, and Chloe about the work that they're doing, looking at the Association of Residents Councils and learning about how partners are engaging in this work. So I'm going to turn it over to Jim, Gail, and Chloe to introduce themselves and share what they would like to share with you about themselves. And I do know, as I mentioned, that Jim will be offering the land acknowledgement. Thanks very much. Really looking forward to learning with you today.
All right, so Jim, do you want to start us off? Oh, you're muted, if you could. Jim, I think you might need to select unmute.
Sorry, I thought we were still muted from the other. I've been thinking about land acknowledgement over the last few weeks, and I have a bit of a feeling that has become routine for a lot of people, and we haven't put much thought into it. So I'd like to speak a bit to why we have this land acknowledgement and what it means. I'm speaking to you today from the territorial lands traditionally of the Haudenosaunee and the Akwesasne and the peaceful people. My question of you and a question of myself that I went and found an answer to was, who were the Haudenosaunee? Never heard of them. When we studied years ago the history of this period, we talked about the battles between the Iroquois and the Huron and the French Canadian settlers, raspberries, gooseberries, all that kind of thing. But who were the Haudenosaunee? Where did they come from? And what I have found out is that the Haudenosaunee is what the Iroquois people, who really didn't exist as such, called themselves. And I've come to realize that the indigenous peoples didn't lose just their land, they lost their sovereignty, their names, who they were, and a whole vibrant culture that was there. And basically, they lost it because, in terms of an assimilation, they weren't consulted. They were told what their names were. They were told where to go. And this kind of design is bad. It leads to such things as the residential schools. And that is a big connection. And that's why the residential schools kicked off a lot of this movement towards recognizing the rights of the minority. So when we look at co-design, we're looking at how one party of greater power is able to cooperate with and draw on the best ideas of the minority party. So what we're talking about with co-design is making better decisions, in making informed decisions. So what we would like you to do today is to stop and think what it means to be treating unequals in a more humane and understanding way for the profit of all of us. So please take a moment to consider the importance of co-design following this session and try to implement it as much as you can. Thank you.
Thank you, Jim. So as Rebecca mentioned, we'll spend some time to introduce ourselves. Unfortunately, Jennifer couldn't join us today, but she is a researcher at the UHN who specializes in researching social connection and long-term care, and I'll be sharing a few reflections on her behalf. But Jim and Gail, do you want to start with your reflections? Sorry, your introductions.
I guess I can go. I'm not first on the screen, but I will step up and introduce myself. I'm Gail Ramsden. I am living at Pearly Health in Ottawa, and I have been here for 5 years. I am here for only physical requirement and have absolutely no mental impairment, requiring me to live in long-term care. So it makes me one of the more unique people, or certainly amongst a great minority of people living in long-term care. And that's allowed me to very quickly understand how things operated here in long-term care. I got involved with OARC very early on, got to realize that what happens here happens everywhere. And there are a lot of problems within long-term care as it relates to engaging residents in developing where they would like to live, in hearing the resident voice and empowering them. And as Jim had alluded to, co-design and collaborative living. So my focus is on raising the issue of how residents live and are treated in long-term care, not physically treated, because that's fantastic and it's very well documented, very well monitored. What isn't as well monitored is how residents are engaged at a mental level and to help design where they want to live. And I really want to focus on those kinds of areas. Thanks.
My experience is much like Gail's. It may be contestable, but I do think that I have most of my marbles still here. And to be here for basically a frailty issue gives me the opportunity to see and to observe. One of the first questions I was asked, I first came in 5 years ago and was looking for engagement, something to stimulate. And so I was volunteering for all kinds of things around, but I volunteered to help a couple PhD candidates with their preparation, and both of them, one from Mac and another from U of T, wanted to know who should speak on behalf of the resident. And at that time, I was quite naive in terms of it, coming from the general public, and I reflected the opinions of the general public. And so I started talking about the various organizations, and I thought that OARC would be the best, but I was thinking that other people should speak for the resident. And I have come very much around to believe that the residents have something to say and that they should speak for themselves, be allowed to speak for themselves, and not just be listened to, but to be heard and to be acted on. What I'm looking for, as much as anything, is that better decisions are made. I think I'm doing this for myself. I'm doing it for the other residents, but I'm also doing it for you people in the audience, because someday I hope you start to think about creating residences that you want to live in. Let me give you a bit of a mashup of Irish poetry. Ryder cast a cold eye on life, a cold eye on death. As you are now, I once was. As I am now, you will be. Okay.
Thanks, Jim. We can always count on you for some very thought-provoking words. So I'm Chloe. I'm the Quality and Evaluation Specialist with the Ontario Association of Residents Councils. And although I've not worked or lived in long-term care, I'm very privileged and honored to say that everything I've learned about long-term care is through regular conversations with residents, including Gail and Jim and other leaders, resident leaders who we work with at OARC. So before I get into describing a little more about our project, I just want to preface that our project is made possible by funds from the Canadian Frailty Work Network, Pearly Health, and CIHR, specifically through the SPOR network funding, the Strategy for Patient-Oriented Research. The funding conditions really set us on a trajectory of co-design, as even with the supportive, like the SPOR research grant, in order to apply, we were required to have a knowledge user as part of the funding team, as well as a knowledge user mentor or someone from the industry, as well as an academic mentor. And I feel like that having the right people has really gotten us far in being able to learn something that's practical. So our research team, is alluded to, is a mix of knowledge users, residents, academics, and then, yeah, people from OARC. And I'll leave it to Gail and Jim to speak more about who we are, who is the Ontario Association of Residents Councils.
Excuse me, I guess you can see on the slides that this organization is a nonprofit organization that is funded by the Ministry of Long-Term Care and was created to represent the residents, or to leverage residents' councils within long-term care, which is now mandated that every long-term care home have a residents' council. This team of people who you see in the photograph is an amazing group of women who are dedicated to going beyond just ensuring the long-term care homes have residents' councils. They are dedicated to making sure residents' rights are being recognized and enforced. And they have, their ultimate goal is to make sure that residents are being listened to and included and sought after for input, and that residents' voice is first. So as you see by the last bullet, with residents, for residents. And that's really what OARC boils down to. They've been around for 40 years, I think it is, 1981, I believe they came to be, and they're just getting better and better.
I think what Gail has said is quite accurate. We need to maybe stress a few of the words. Empower. Part of that is convincing people that they have the power and that they have the opportunity. The ministry mandated this. Mandate is a very strong word. Every LTC in the province must have a residents' council. And there is contact between the inspectorate and the people in the ministry to determine what is happening. The one thing that really needs to be outlined here is lived experience. This is something that the residents have that no one else has. You have to be a resident. I was talking to our physiotherapist, a great young man, very active, very good at his job. And we were talking about living in here. And he said, well, I've been here 17 and a half years. And I said, okay, that's interesting. How many nights have you slept in this building? He said, none. And that's my point. If you want the lived experience, and it is different at night than it is in the daytime in the LTC, you can find it out from the residents. Residents know what it is like to live in an LTC. Okay, next slide.
Next slide. So we'll go into a bit of background about our research. So we are doing a 3-part project that includes a scoping review, some qualitative interviews, and the findings of these who's ultimately create a toolkit that can help long-term care homes facilitate resident engagement. So when we talk about resident engagement in the context of our project, we're specifically referring to systems and practices of how residents can have their opinions and lived experience reflected and give direct input into home level decisions. And the degree of engagement can range from being consulted to partnering with the homes. Um, and home level decisions, in our case, refer to, I like to explain it as anything that impacts more than one resident. So it could be something like the food or the programs, or even the mission and vision of values of the home, who gets hired in the home, how can residents get involved in those kinds of decisions as well. So to define resident engagement, we've adapted this framework from Carmen et al., and it recognizes 3 key aspects that we believe as part of engagement, and is that there's engagement activities that range along a continuum. So you can have consultation, or you can get more and more involved into involvement and partnership. For our scoping review, we were particularly interested in how residents are engaged in the levels of involvement and partnership. And as I mentioned earlier, particularly interested in home level decisions, so that middle row that you see there. We started this project about 1.5 to 2 years ago now, because it was a resident identified priority. As mentioned earlier, OARC does everything with residents, and so this is something OARC has identified in their work with residents. It's also aligned with the culture change movement, and for those who are unfamiliar, a definition I've pulled from the Pioneer Network is that culture change is the common name given to the national movement of transformation of older adult services based on person-directed values and practices, where the voices of elders and those working most closely with them are solicited, respected, and honored. So it really emphasizes on that person-centered care and person-directed care. We also started this project because it's relevant to updated long-term care policy. So some of you may be familiar that the Fixing Long-Term Care Act came about in 2021, and with that act to update to the Long-Term Care Act, there's been expanded scope to residents' councils, and also a requirement for residents to be involved with long-term care homes quality improvement committees and practices. And then lastly, it addresses a knowledge gap. There's not that much research out there, as we've continued confirmed with our scoping review later on, about how have residents been engaged, what are the different approaches, barriers, facilitators, and so forth. Gail and Jim, could you guys speak to why is resident engagement important?
I think for me, the biggest thing for me is the spirit of the act, which promotes resident engagement, versus the application of that spirit within the home. And what I mean by that is the government has created a framework around which long-term care homes have to operate. And those are rules and guidelines. And those rules and guidelines influence or dictate how I'm going to live within long-term care, which as a functioning adult in Canadian society hits me the wrong way. The spirit of the act is then implemented or applied in the long-term care home. And when the long-term care home leverages on top of that additional guidelines or policy, then my ability to live my best life is even more impacted. And I have a problem with that.
Mhm.
I am a fully functioning human being, and I would like to be in control of how I live. And for me, the engaging of residents in defining what they call or where they call home is exactly what is required. We have to acknowledge that adults don't need to be told how to go about living or under which conditions they're going to live. To go back to the comparison that Jim made in the reviewing of the land acknowledgement, it is on a parallel with what happened with our Indigenous people, where someone else came in and dictated how they would live, what parts of their life they could retain control over. So for me, that's why I'm involved. And that is what, to me, engaging residents in that policy, in the quality improvement, in the design, in the food committees, in every aspect, hiring, in every aspect of living in within long-term care. That's what's important to me.
Gail made a strong point earlier about the physical care that people in LTC receive. And it's superb. I have no problem with the physical health. It's when we start talking about mental health and the importance of the connection between physical and mental health. If the mental health is being underserved, then what happens to the physical health? The old ideal was mens san, corpus san, healthy body and healthy mind go together. They're equated. Well, there's no equation at the moment. There's some attempt, but a lot of it is still governed by a traditional warehousing method. It maybe not so bad for people like Gail and myself. We can create our own activities, but what we see is a deterioration of other people that don't have that same kind of mental strength. And where do we go from that? Traditionally, there's sort of a warehousing thing, out of mind, out of sight. That's a real difficult thing to create. But if you look at the literature review, which this leads to, is you should look at it from what is not there. There has not been much attention paid to the aspects that we're describing to you today. So we need to take a new look and maybe look at some new designs for LTC to make them more home-like. It's kind of ironic that that word is used, home, and you don't get to make the decisions that you would ordinarily make about your home. Who comes to see you, when they come to see you, what they can bring or what you can have in your room. There are decisions made that are better made in conjunction with other people.
That's true. I feel like that last point about home really encapsulates our goal at OARC, and especially for this toolkit, is to really how can we make long-term care home for the residents, giving them their autonomy, helping them with their mental well-being, and so forth. So this slide is a brief overview of the three-part project I described earlier. So first, with our scoping review, to really try to understand what has been done in the past. Our main questions for the review were: how have long-term care residents been engaged? What are the reported barriers and enablers? How have considerations of diversity been integrated into these engagements? If there's been any considerations for dementia and cognitive impairment integrated in these engagements, and how have these engagements been evaluated? So we followed a pretty typical scoping review process as described by Levac and as well as OARC and O'Malley. And I think what makes our process arguably more unique, but true to OARC, is that there is consultation happening throughout. So the research questions were co-created with OARC. During members of our OARC team also helped us identify relevant studies going through that screening process. We checked in with Jem and Gail regularly to just update them on where the progress was, and they were also involved in interpreting the data. Once we had the results and started developing themes, we asked them, like, what do you think is missing? What stands out to you here? And some of that will be shared later. Something interesting that came out from our scoping review is that there's publications on this all the way from the 1960s, but as we read some of these articles, it was interesting to see how some of the engagement methods described don't feel that different from what we hear at OARC today. Most of the articles that we read were from researchers, and then also quite a bit from people working in long-term care as well. They're mostly in commentaries, just describing something that might have happened in the home or describing the residents' councils there, and then mostly North American studies. So what we found is that residents' councils are a very common approach to resident engagement, even from the 60s, and that might be related to the legislation that enabled residents' councils, especially in the States around that time. Other things, overall decision-making refers to research that considers residents' general involvement in home-level decision-making, so aside from residents' councils. There's also resident groups or committees like education initiatives, such as like something like a welcoming committee were things that came up, and other include things like residents' rights campaigns. Residents got involved in a few different ways. So some were recommended by staff and volunteered into creating these residents' council groups. And then sometimes they were elected by peers as one of their sustainment practices, and the others were volunteers. Examples of home practices and policies that we found in the literature included a large amount was around food and how residents were involved with deciding their menu or designing their dining practices, but there are also things including quality improvements, activities like programs, the spatial design of the home, staff behavior and staff hiring, as well as staff education, hospitality, and one of the ones that was interesting to us was policies and practices around how to communicate a death in the home as well, and to really honor the passing of peers in long-term care. So some of the barriers and enablers we found are actually two sides of the same coin. So here, for example, you can find meeting structure and logistics as both a barrier and enabler. I'll briefly describe some of these. So for example, fear of retaliation refers to residents who might feel discomfort in expressing their grievances. And cycles as institutionalization. So there are several articles that describe residents feeling inadequate and burdensome. And then on the flip side, there's also several articles describing staff lacking faith in the ability and capacity of residents to be involved in decision making. And so with these beliefs, you can see how one belief reinforces the other, and it's something that you need a break. I'll just move forward. So with
Just,
that,
sorry, Chloe, before you move on from that,
Mhm.
if you could just back up for 1 second.
Yeah, for sure.
I think one of the things that exists as a barrier is the imbalance of power, excuse me, the imbalance of power within the long-term care structure between the staff and management and the residents. And even when you engage residents within committees, teams, activities, even when you engage residents, there is always going to be that imbalance of power. So it becomes very important that you overlay all of this work with this culture change movement, because you need, management and staff need to be thinking in terms of resident engagement as equals. It doesn't matter how many people are there, but they have an equal voice, an equal contribution to the task. So imbalance of power, I think, is a huge thing and needs to be always, always in your mind. Thanks, Chloe.
So for the rest of the scoping review questions, I think the long story short of it is that there weren't many studies that describe diversity, or they would mention how many residents were involved, but nothing else about the residents. And I think that also speaks volumes into the priorities of research in the past. There haven't been many considerations of dementia or cognitive impairment. The ones we did find, I listed as examples on the slide. And largely, as mentioned earlier, a lot of these studies were commentary based or narrative based. And so the evaluation is mostly just people's own reflections. There's not a lot of like qualitative or quantitative data collection to look at what the outcomes of resident engagement are. I'll hand over to Jim and Gail again. Yeah, what were some of the research gaps that came up in our scoping review?
Go ahead, Jim. Jim, do you want to go ahead with this one?
I'm just sort of thinking about the engaging residents with cognitive impairment or dementia. That's a real issue in terms of what they experience and knowing that. That's one that has to be sought out. It may be that we need more programs that cover a range of abilities. Music programs, arts programs, things that stimulate on that side. But we got to get these programs going, and then you can research them. So it's problematic. We've got good people who are doing good things, but the pavement to hell is made up of good intentions. Go ahead, Gail.
I was just going to say, I think also in the past, one of the biggest things that happened with research was an idea of an improvement of a gap that needed to be resolved, and researchers going ahead and doing what they do best. But doing it in isolation with engaging the residents. And sometimes what you think is required isn't actually what the residents feel is required to better their life. So there was that gap in what we think you need and what is really required.
Thanks.
Again, that culture change. Yeah.
Yeah, and I think that really goes to emphasize why it's important to engage residents from the start, or the community knowledge users from the start, because they know best what their needs and their gaps are, rather than as researchers or people who aren't living the experience. And so the next part of our study are the qualitative interviews. So our scoping review figured out what has happened. Qualitative study was to figure out what is currently happening on the ground, and especially diving deeper into what are the current barriers and enablers people are experiencing when it comes to resident engagement. And so OARC was instrumental in our recruitment process. Again, it's one of the privileges, honestly, to work with someone very well networked. Their emails, we got like 30, I want to say, interest emails off the bat. And then so we did online and in-person interviews. There's audio recorded, semi-structured, and then we transcribed the audio to do thematic analysis. We got a pretty even distribution of interview participants, so 11 residents, 11 team members, and then 5 from leadership team, which may include administrators, but also CEOs or key managers. And our main themes that came up, we were, I guess, partly expecting that cognition would come up quite a bit as a barrier, and it did, but I think what stood out to me was that leadership accessibility and the relationship really between leaderships and administrators and the residents was reiterated and again as being really key to resident engagement in the home. But also recognizing that all the residents are different. Residents will be interested in being engaged in different things. It depends on the background, it depends on what their life was like before long-term care and what their career was like, what their personality is like. And so leveraging and also knowing how to engage residents according to their interests came up. And then there's also similarly reflected to our scoping review on key sustainability and communication practices is a key part, just making sure like things like posters are at an accessible height for someone in a wheelchair, nuances like that. Anything to jump in or add? Okay. And so, as I mentioned before, ultimately these findings are to create a toolkit. And so the tools we are including are various instruments, including fact sheets and surveys, and then compiling these together, hopefully for a very user-friendly, action-oriented compilation of resources for administrators, but this details it better. It's really for anyone who's making decisions in the home, which includes long-term care administrators, but also other managers and even residents. The ultimate goal is that we don't want engagement to be just a box-ticking exercise of, oh, you have a resident on your quality committee, or oh, you have them sign off on the menu, but really getting them from the start to ask them what they want, what direction, what their needs are from the very beginning. So moving really from inform all the way to empower. And so our toolkit is also being co-designed, and how we're approaching this is that we've a few different groups that we're continuously getting feedback on what tools resonate with them, what tools they would prioritize. And so we have our OARC's resident leaders, and they're the ones who helped us identify who the target audience of this tool really should be. We have focus groups with administrators to better understand which challenges that we identified from our qualitative interviews are the biggest hurdles that they're facing. And of course, we also have our OARC team members who are co-creating these tools with us, as well as field experts. We plan on consulting with people such as CLRI who have a great expertise in diversity and inclusion, and as well as other researchers who specialize in dementia research to understand how we can adapt our tools to the current demographic of long-term care that includes people with cognitive change. So key content that will be include a readiness assessment, links to key resources, as I mentioned earlier, and case examples, so like real life examples and stories of how homes have included their residents to hopefully inspire and let other long-term care homes realize that it is possible, and also to build potential peer support. And so I know we are a little short on time, but this slide is mainly to summarize in this research journey that we've had together, what has really worked for us. So I think for myself personally, I think working with Gail and Jim, they have been key when it comes to interpreting a lot of the findings that have come up. They've brought to light just a lot of things I wouldn't have thought of, and as you probably can tell by now, they're both very thoughtful and thought-provoking people. Something that Jen has shared again and again has that OARC, because of the strong network, but also our fundamental value of working with residents, has enabled us to do this kind of co-design work a lot easier, that we're aligned in this vision. Yeah, Jim and Gail, what are some things that works or challenges that you have felt through our research journey?
There's one technique that I would like to stress in terms of being in the toolkit, and that's management by wandering around. That encouraging managers to get out of their office and just walk the building, talk to people, find out who they are, greet them as people. You're in their home, and they want to know why you're in their home, what you're doing there. Sometimes it's just as simple as holding a hand or putting a hand on a shoulder, the human contact, and some kind words, softly spoken. But get out of your office, wander around, see what's going on. Go find the problems. Don't wait till they come to you.
Sorry, I did get bumped off, but I'm back. I apologize for that glitch. I think for me, building on what Jim just said, and that is the difference between recognizing that we have to move beyond ticking the box to engaging residents at the front end and having them involved, but not just having people on committees, not just involving people, but to working towards working collaboratively. So as to get away from that power struggle that I referred to a little earlier, working collaboratively, working together to find out something, to discover what will work for the residents, and that management and the administrators can be comfortable with. As Jim said, the reality is this is our home and you are working in it. And so we need to try and find a balance on how we can work together collaboratively to make it as good as it can be.
might just jump in. Thank you, the three of you, so very much. I was taking lots of notes during your presentation, and I just want to thank you for your profoundly thoughtful insights. I think we've all had valuable learning today about the perspectives and contributions of residents in long-term care, about the importance of centering the resident perspective and experiences in care. And, as Jim and Gail have both said, about ensuring that their home feels like a home, including, their rights, respecting their rights, respecting autonomy, and also thinking about personhood and humanity in approaches and the care that they receive on their home turf, right? And I think we also learned a lot from, the three projects the couple that are complete and the toolkit that's in development, in terms of thinking about those kind of mutually reinforcing factors that enable or create barriers to meaningful engagement in shaping processes in care homes and shaping research. So really, really thoughtful. I think one of my key takeaways was really around, how do we create a culture of change and improvement that centers the experience and takes into consideration inherent power imbalances and intentionally seeks to address it so that the contributions of residents are really valued. So thank the three of you so much. We really appreciate it. And I want to open it up for questions from our audience. If you have a question, please, raise a hand. Okay, we've got a question. Any suggestions for researchers that are not on site with residents and are relying on the relationship that the site staff have with residents? Any thoughts on that?
I don't think you can rely on the site staff. The site staff's going to, their outlook is going to be how they think the resident wants to live. You have to involve residents. You cannot rely on second, third party. If you can't be on site, then arrange for Zoom, whatever. You have to have residents' voices at the table.
Yeah, I think currently we're just at the beginning stages of our project, but I think that right now we are relying, pretty heavily on that site staff. But the thing is, we're a little bit limited in that direct relationship because the residents have limited access to like internet and phone.
And I think if you saw the expanded version of the presentation where we get into exactly what barriers exist, this is one of the barriers that prevents engaging residents is things like technology, is things like accommodation, and those all of those things. And so it's up to the researcher or the whoever is orchestrating a committee to address those things if they really want to have residents at the table, the resident voice at the table.
Okay, great. Thank you. I think there's.
Thanks for that.
Can I answer that question as well?
Sure, please, Jim. And then we have a question from Lynn, and then I think it was Michael had his hand. Oh, sorry, Joyce, you had your hand up. You're beside each other on my screen. Okay, go ahead, Jim.
Two areas that I would like to see researchers go after, and that's a comparison or a study maybe just of the experimental LTCs. They're not all the same pattern across the country. A place like Sherbrooke in Saskatoon should interest a number of people and see what happens there. How do they compare? What are the differences? Which is more effective? And the other question that I would like researchers to go after is a thorough definition of quality. What does quality mean?
Okay, great. Thank you so much.
I'm going to turn it over to you, Lynn, in just one second, but I just want to mention to anyone who needs to leave the call, we will be following up with a feedback survey through email. So watch for an email from the collaborative, from Allison, that we welcome your feedback and look forward to hearing from you about that. Lynn, I'll turn it over to you for your questions.
Thank you. Such a great presentation, and I just have so much gratitude for the work that went into this. I'm really looking forward to the toolkit. I am an occupational therapist and a researcher, but relatively new to the long-term care space. And I've been involved in a lot of participatory research, co-design kinds of things. And one of the things that I've learned, in addition to the issues around technology, is that we often ask community members to be involved without compensating them. And so please take my question, with that kind of background. But I'm just curious to know if the legislation allows for or does not allow for resident councils to be reimbursed financially for their involvement in resident councils or in research related, or, is there any guidance about that that's coming forward?
I would have to turn to my colleagues at OARC to double check, but from my understanding, there isn't any restrictions other than like the typical honorarium limits. I know for most homes, residence councils actually have their own account funds too, and so they're able to kind of keep that money directly for their residence council. Yeah, that's my understanding.
So is the toolkit going to have something about compensation for people on the residence council?
Because the toolkit is for home administrators, we are hoping to have some tools around how to get residents involved with finances and like figure out financial priorities in the home, how the home spends their money, but not specifically on compensating residence councils.
And I
Thank
see
you.
we have a bit of a response in the chat here from Stephanie Ventura about that there isn't any funding provided through the legislation that's specifically set aside for residence councils, but it's a great idea, and Stephanie has been asked by residents about that as well. So I think it's an idea that has been discussed in a few venues, but I'm not sure there's been any movement, at least in a systematic sense, to seeing that across the long-term care community. So
Thank you.
thank you. Joyce, you had a question or comment, please.
Yes, I'm Joyce Lokes. I'm older adult partner participating with the collaborative, but I'm also a full-time caregiver for my husband with Alzheimer's, and we have just finished visiting several long-term cares to get on that very long waiting list. And it was eye-opening in several ways, not in a lot of good ways. I liked what I saw, but now listening to what it's like, for the residents, and I want it to be his home. How do I ensure that, could I be his voice beside him, sort of like an interpreter, as on a residence council, to ensure that his voice is heard on these councils? I know there's a family council, but something that is his voice. Has there been any thought put to that?
I'm the president of the residence council within my home. And while the definition of residence council is that it is for residents, I do have members of my council who are cognitively impaired that I allow their caregiver to join us at our meetings and speak for that resident. That is me personally within my own residence council, but I feel it's more important to have that representation than to exclude the person altogether.
Mhm.
Thanks so much.
Thank you.
I'm just going to suggest, we're just about to transition. So thanks for everyone who joined us today. If you'd like to stay on for our reflecting together, I think there's been great engagement so far, and I have the sense that people want to continue talking about this really important topic and learning from our guests. I understand that Tina Falbo and Michael Kirk, who are some of our partners in the Collaborative for Health and Aging, are going to be leading. If we have a big group, we'll have 2 breakout groups, or if we have a smaller group, then it may be one group that is having conversations this afternoon. So I'm just going to transition us that way. Before we do, I want to thank our speakers again. You've stimulated a lot of great insights and questions and conversations. So really appreciate everything that you've shared with us this afternoon. If you want to hear it again, for those of you on the line, it will be posted on our website, and you can access the recording or share it with your colleagues who may be interested. And we look forward to connecting with you all again soon for our next collaborative conversation. So thanks so much, and look forward to continuing our conversation.